Hi, I'm Dr. Mark Langold. I'm a board-certified plastic surgeon, and one of the most common things patients tell me is, I wish I could get a clear, honest answers about breast augmentation without having to book a consultation first. So today I'm doing exactly that. In this video, I'm going to answer the most common questions I get about breast augmentation, including implant size, silicone versus saline, placement options, over or under the muscle, recovery, risks, results, and everything in between. And what better way to do that than to make it completely free and available here on YouTube. Whether you're just starting your research or you've been thinking about this procedure for years, my goal is to give you as much clarity as possible. We're going to talk about it. What makes someone a strong candidate for breast augmentation? How to choose the right implant size for your body, silicone versus saline, what really matters, over or under the muscle placement, what recovery actually looks like, how long the implants last, the real risks and how we minimize them, and much more. If you're considering breast augmentation, this video will save you hours of searching and help you understand what's truly important, especially when it comes to safety, proportions, and long-term results. So let's get started. By the end of this video, you should have a much clearer idea of whether breast augmentation is right for you and what to look for when choosing your plastic surgeon. Will they look natural or too fake? The fear of looking fake is probably the most common thing we hear, and we get it. That's why our entire approach is based on proportions, softness, and shape. We look at your frame, your goals, and how you want to feel in your body. Every plan is customized so your results look natural, just fuller, more proportionate, and lifted. What does the recovery look like? Most of our patients are surprised by how smooth the recovery is. You'll need a few days to rest, but most return to desk work within a week and back to normal activities by week 3 or 4. We'll give you a step-by-step recovery plan. Check in with you regularly and make sure you're cared for every step of the way. How do I choose the right size? You won't have to guess. We actually let you try on different implant sizes using a sizing bra. And we use photos, measurements, and your aesthetic goals to help you find the right fit. Our goal is not just finding the right size, but what actually feels right for your body and the result that you'll love. I'll also help guide you with my professional opinion. I've helped thousands of women through this exact same process. How much does it cost? It's totally normal to have concerns about cost. This is a big investment. We offer flexible financing options to help make it more accessible, and we'll walk you through those at your consult. We never cut corners because the outcome and your safety matters too much. What we can promise is complete transparency, no pressure, and a plan built around your goals. Will I lose sensation? Some temporary numbness is normal, especially early in healing, but permanent loss is rare, and we use techniques that carefully preserve nerves as much as possible. We'll go over all of this in detail so you feel confident and well informed. Can I still breastfeed in the future? In most cases, yes. You'll still be able to breastfeed after breast augmentation. We use surgical techniques that protect milk ducts and breast tissue. If that's something important to you, we'll make sure it's factored into your treatment plan. Are implants safe? What if they pop? We only use FDA-approved implants, proven safety records. Ruptures are very rare early on in your healing process, and if they do happen, the implant can be safely removed and replaced. We're fully transparent about the risks during your consult and always prioritize your long-term health and safety. What if I regret it later? It's totally normal to have hesitation. This is a big decision, but most of our patients say the same thing afterwards. I wish I've done this sooner. The consult is no pressure space to explore your goals and decide if this feels right for you. Do you revise other surgeons' work? Yes. We handle many revisions. Whether you're unhappy with the past results or just ready for a change in size, shape, or style, we'll talk honestly about what's possible and create a plan that honors both your goals and your body. Will people know I had surgery? Only if you want it to be. Our results are designed to look natural and seamless. Most patients hear things like this: "You look amazing," but no one can quite put their finger on why, and that's the sweet spot. What misconceptions do patients commonly walk in with? I would say the biggest misconception that I hear is that their implant is going to look too large or too big for their frame. I would say I hear this about 90% of the time from my new patients, but it's really not the case in my practice. We will not place an implant that's unproportionate and doesn't match your frame or is not aligned with your goal. What do your happiest patients say changed after surgery. Generally, I hear things like that they feel more confident, they feel more like themselves, their breasts feel fuller, they fit better in clothing, in a bathing suit, they feel more confident during dating or with their loved ones. They also say things like, I love them, I feel up my bra, I look better in shirts, and I can look at myself naked. Let's talk about silicone versus saline and what really matters. Well, in today's day and age, silicone implants are by far the most common. However, both implants can be an option. There are some advantages and disadvantages to each type of implant. For example, silicone implants generally feel more natural. They are more cohesive, meaning they maintain their shape inside the body, inside the breast, better than saline implants, and have less rippling. Generally, they're a bit softer as well. Saline implants are usually heavier. They ripple a bit more. They feel a little firmer. I would say the major advantage of having saline implants is that if you have a rupture, it's almost like a flat tire effect where the implant goes flat and the breast goes flat and you know exactly that it's ruptured. With silicone implants, there's a bit more maintenance. As of today, FDA requires serial MRIs starting at year 5 to year 6 after breast augmentation, or high-resolution ultrasound to monitor for silent rupture. That's when your implant ruptures, but you don't know that. So that's where the imaging comes in, and then the recommendation is to keep getting MRIs or an ultrasound every 2 to 3 years after that first 5 years. Hope this is helpful. Please let us know if you have any questions regarding this topic. So over the muscle placement versus under the muscle placement. What does it actually mean? Well, essentially 2 different pockets that we commonly place breast implants. They both are a good option. It all depends on your anatomy, your goals, and the type of implant we're using. So for example, if someone is a very athletic person and they want to preserve majority of muscle function, sometimes we use a more muscle sparing technique. Try to place implant primarily over the muscle to preserve muscle function, anatomy, and improve recovery. However, in some patients that are very thin and need more tissue coverage, the implant needs to be a little more hidden, and that implant serves what I say kind of like a duvet cover to completely camouflage the implant and prevent any chances of rippling or visibility. So what are the risks and how do we minimize them? Well, obviously any surgery can have some risks. However, the way we perform breast augmentation is very safe. We go to an accredited surgery center with a fully licensed anesthesia provider, and we perform this under general anesthesia. During the surgery, I use meticulous sterile technique to make sure your implants are placed precisely in the right pocket, and the closure is done with absorbable sutures, and we use a very, very small incision to minimize healing complications. So what is an internal bra? So internal bra essentially is a all-encompassing term for soft tissue support. What does that really mean? So during your breast augmentation surgery, I frequently use a little mesh, or I like to call this scaffold, essentially to kind of reinforce the implant and provide extra support. So with time, as the healing occurs, the implant doesn't bottom out and go below the inframammary fold or start to sag or drop. So that internal bra, think of it as an insurance policy where it'll provide extra support for that implant, especially if it's a little bit on the larger side, so your results are long lasting. How long do implants last? Implants can last for a very long time. As of now, FDA recommends getting your screening done at 5 to 6 years. If you have silicone implants, that includes either an MRI or high-resolution ultrasound to make sure there's no rupture or leak. The longer you have the implants, the higher the chances are for implant rupture or capsular contracture or implant changing its shape and position. However, I see patients whose implants have lasted as long as 15 to 20 years or sometimes even longer. So the most important thing is continued maintenance, follow up with your plastic surgeon, and imaging guidance, and your implants may last you over a long time. If you have any other questions you need answer, drop them in the comments below. But if you're wanting to take the next steps to your surgical goals, give us a call to schedule a consultation. Looking forward to seeing you here at Langold Plastic Surgery.